Igbo be anyị unu emekwe o na afụghị ife ha ihe nji si n'ihi aga n'ilo bịa lụhe na onye Igbo ka ibu yubunye ubu ya enu wee buda akwana ka mmadụ emekwena ikoda abịa si n'ihi emekarị onwe maka na o kwesịrị onye Igbo ọbụla na-ebunye ubuwe onwe onye mbịa ka anyị kwuo okwu tata nwa onye Igbo bi na Canada na-eme ọfụma nwa onye Igbo si na Umuahia South Local Government pụ ha ndị Umuahia bekunu ụlọ ndị Abịa bekunu ụlọ ndị Igbo be anyị bịanụ ndị Igbo kwezuenu unu afụ ife na-ekwu onwe ife ha anyị ji ekwukarị okwu ndị a na-ekwu danani ka anyị kwu maka Ụzọma Chioma Asagwara anyị afụ ndị Mụani bụ ndị Abia steeti wee bịa bunye ọlụ oyibo Canada kawa n'ọzụ Ụzọma jekwa akwụkwọ bịa bụlụ nọọsụ ọlụkwa ọlụ aka nọọsụ ọ bụ Ụzọma gbakwa basketbọl ka o jee akwụkwọ ọ gbana basketbọl na nkịtị ọ gbakwa agbapụ ife Ụzọma asị mba na ọ chọna ka enu ebedomọfụ n'ọnwa ife nọ n'ime ọ chọ ibupụ enyi ka ụwa afụ Ụzọma ejebanya politiks na 2019 unu maina province be Ụzọma nọ na Manitoba n'ime Canada abịa họlụ Ụzọma ka ọ dana n'oche wakpo member of Legislative Assembly n'ime Manitoba province bụ ọnọ na Canada Ụzọma emesikwa nke fụọsị mba o na-adịka m emezude na mmụọ ndị Igbo na-asị m mezie ka mmekwu ka na-ebupụ afa ndị Igbo n'ilo Ụzọma bịa chipụkwe bịa je ga-azụ oche Deputy Premier and Minister of Health n'ime Manitoba bụ nọ n'ime Canada October 18, 2023 ka Ụzọma danaga n'ochefu onye si na ndị Igbo adịghị eme ọfụma onye akọdali ya akịkọ afọ ịbịa na-egekwa onye fụ ntị bịa ka m gwa gị na m bụ Adani Ọma 101 ọ Adani Ọcha 101 ya gwa gị ndị Igbo na-eme ọfụma nke a bụ na anyị ji na-etu ọnụ anyị kachasị ndị ọzọ ya bụ ife na-ewughe weni agwaga m ya ọfụ nchọ ka ige ntị bosi ekwu bosi asụ sụpịrị ndị Igbo na-emekọ ọbụba genue ntị kunu nụzi okwu ndị ọzọ unu gee ntị unu afụ ka ọbala Igbo na-agahume na ụwa unu afụ ka ọgahume na ụwa unu afụ na ndị Igbo na-eme ọfụma ka anyị hapụ ndị nzuzu si na ndị Igbo enwe n'isi ikirisikwozi etusalima ka Chukwu gozi azọkwana subscribe to our YouTube channel ị ga-enjoy yi YouTube channel ije na comment section na YouTube channel ọsụzi woto ndị Igbo be anyị jikwa YouTube sokwe m na Facebook mana kịta YouTube ka ị ga-aka afụ ife onyonyo m ka Chukwu gozie onye ọbụla dalụ n'oshine ikirisie azọkwana tụsa.
So our Minister of Health, Seniors and Long-Term Care, Uzoma Asagwara. Minister, thank you so much for joining me this morning. It's been just over a year since your cabinet was sworn in. And I wanted to ask, first of all, you made it very, very clear that a main priority for your government was healthcare and the care of all Manitobans, not just here in the city, but also rural Manitobans as well. Reflecting on the past year, how do you feel like your government has held up to this promise?
You know, I feel like our government has done a really good job of listening to Manitobans from every corner of the province in terms of what they want to see their healthcare look like. And we know that in order to make the changes that Manitobans want to see, we have to understand what they want to see. And so the Premier and I have had the opportunity to undertake a listening tour. We've been all across the province. We've been in Winnipeg, rural Manitoba. We've been in the north, listening to frontline healthcare workers and Manitobans share with us their hopes, their ideas, concerns, and experiences of the healthcare system. And through that listening tour and through the work we've been doing with our partners, I think we've been able to take some really important steps in making healthcare better and fixing the previous damage that was done to the healthcare system over 7.5 years.
Can you talk about what you've learned over this past year, being on the front lines, being all over the province, and hearing from both patients and staff?
Well, what I've learned and what's been reinforced is that healthcare is Manitobans' #1 priority. Doesn't matter where you go in our province, folks are talking about their experiences in emergency rooms or trying to see a specialist or a doctor. And they've been sharing a lot about what healthcare means to them, being able to access essential healthcare no matter where they live. And so what we know as a government and what we've heard resoundingly is that we need more people on the front lines of our healthcare system. We need more nurses, doctors, allied healthcare professionals, and staff. And it's been wonderful to hear directly from those folks about how we do the real work of actually retaining those folks on the front lines and also recruiting and training more healthcare professionals. And so through that listening, through those learnings, and through taking real action, we've been able to take some big steps, like hiring a net new 873 healthcare workers on the front lines of our healthcare system across Manitoba.
Is there something that you learned that you were surprised to learn and that is now guiding you through the next year?
Oh, it's such a great question. I would say we've had the incredible opportunity to meet folks from all aspects of healthcare. We've heard from folks who maybe haven't always had the opportunity to have their voices and expertise heard directly by government. What I've really taken away is that every single perspective matters, that every single person who helps keep our healthcare system going, from the environmental staff workers, housekeeping, frontline folks, there's administrators who understand the inner workings of the front line. We need to listen to those folks and invite them into the conversation about how we fix healthcare together. And I would say one of the biggest pieces in doing this work and learning from folks who have been generous in sharing their knowledge with us has been the way that people want to do the work together. There's a lot of years before our government where people weren't engaged. They weren't listened to, they weren't heard, their expertise wasn't valued. And people are really eager to share what they know with us and be a part of the solutions. And so we know that doing things together is the way we accomplish hard things. And here in Manitoba, we've got the best communities who do that work and the best healthcare workers who do that work. So we're committed to working together, working in collaboration and partnership, and continuing the work of moving our healthcare system in a better direction.